WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Welcome back, ladies and gentlemen. We Should Know is on there. My name is J.W. Simmons. I want to thank you for being with us today. We look forward to seeing you each and every week right here at Star Communications Channel 16, WCLN Radio with a summation in the Sampson Weekly newspaper. A lot of conversation this week, the week before, and the week before that about a virus that has contained us, controlled us, shifted us, and moved us around. And to quite a bit of folks will tell you has created a large sense of anxiety. We have two guests with us today that kind of can explain that to us and talk to us about what's going on in that world of viruses, if you will. And that is the Director of Public Health, Wanda Robinson, and Director of Nursing for Public Health here in Sampson County, Parrish. I want to first of all thank you guys for taking time out of that storm outside that door of questions, of meetings, of challenges that you've been facing over the past few weeks. This virus that we're talking about, COVID-19, I would say, Wanda, just a matter of a few days ago, folks probably couldn't even tell you what COVID-19 is. We've been inundated with information on the state level, on the federal level. We've been forewarned of a lot of things that's occurring. The stock market's bottomed out at least 2 or 3 times. As we sit here today, let's talk about what's going on the local level, on the level of where people know you and know Kelly and they see you. And maybe before we've thought of public health as an agency that supported our community and helped folks in various kinds of health-related capacities. But you guys have been at the forefront for a long time on the local level. We don't see a whole lot of the work you're doing. Talk about that for a minute.
Thank you very much for allowing us to come to present today. And this is a subject that has been with us probably for about 2 or 3 weeks now. As I've been in public health for about 30-some years now, and our main goal is to protect the public's health. And so when we began our investigations with the coronavirus, which is sort of a sister virus to the flu, but it's a bit different, and this is new for us in that we are trying to learn as the public is learning. But public health has been working now for about 3 weeks. We initially got the information from the state. We have been boots on the ground in that we've been working with our providers, working with our hospital, working with other agencies, trying to get information out. We've been doing contact investigations, and that's where we, whenever we think we may have a case, we're out there in the homes, talking with the family members, getting those contacts, making those contacts aware of what they need to do to stay at home and how we can keep our public safe at that point. So we have been really busy over the last couple of weeks doing those kinds of things, trying to make sure that Sampson County is a safe place to live.
Kelly, one of the things I think about when I think about someone in charge of nursing and those kinds of things, and looking at your title, you're kind of the right arm person for Wanda, it sounds like. When we look at what's going on in this dynamic now, and we think about all of those folks out there that you're trying to get to understand certain things. There's so many components of that. Wanda just mentioned one, that's the fact of staying at home if you can, and those kinds of things. Tell us about what goes through your mind, what you've seen over the past 3 or 4 weeks. What are some of the areas that are key challenges for you?
I think one of the key challenges is making sure that the correct information is getting to the public. Social media, although it is great for connecting with friends and family, we've seen a lot of rumors and misinformation out there on Facebook and things like that. And on those outlets, it can spread like wildfire. So just making sure that people are getting the correct information out. That's one of the reasons we established the COVID-19 hotline with Sampson County Health Department to make sure there's someone, a nurse, on that phone constantly that can answer the public's questions and get the correct, accurate information.
When we look at a lot of the information, Wanda, I know I've heard you say this a number of times, always refer to the CDC website, the Centers for Disease Control, and there's a lot of information there. When we look back at what you're trying to disseminate here, there's also information there that either is beyond our reach or that we can't use and that kind of thing. So when you're messaging from where you guys are, what are some of the things that folks in a rural county and a local area here need to know about?
So we have developed a web page in the county government because we have become aware that the correct information was not getting out into the community. So we've been very, very mindful and in working with our county partners in putting the correct information on our website. This is what you need to do, and this is where, looking at information from the Department of Health and Human Services and then the CDC also. Those have been our main sources of information. Anytime we have issues, we refer to those websites plus our state consultants, our state folks, to make sure that we are distributing the correct information. Those have been the two things that we've been very mindful of the last 2 or 3 weeks, making sure we're getting the correct information out into the public.
It would be an understatement to say that you guys have, this is full time, it's just kind of overwhelming, everything that's been going on. Before all this happened, you had real jobs with public health. You had certain responsibilities with public health. How are you able to portion out that kind of thing? And what's happening with that function that has already been going on and continues to go on with public health? Has that been compromised in any way? Have you had to call in other assistance? How do you deal with that? Because it just seems like to me that with all of this information to try to maintain everything else that's going on, the wagon could easily lose a couple of wheels here and there.
We have been very conscious and have been looking at our staff. Initially, Kelly and I was the forefront doing multiple things multiple times, but it became a bit more consuming, so we've had to pull in the rest of our staff in, and we have a sort of a organization chart right now where we are pulling in nurses, we're pulling in our information person, we're pulling in our environmental health agent to help us with it now. We've run, we do our regular job, plus we're trying to stay out front of the coronavirus. So, and that may change in a bit because we see now that we are beginning to have more issues with coronavirus, which is going to make us pull our other staff and assist us with this issue now because it is becoming more and more of an issue for us. And I'll let Kelly kind of talk about some things from the clinic side as to how we're handling those kinds of things.
Okay, Kelly, yeah. Tell us about that because I think people are kind of concerned about, okay, what is the response for this? And how does public health step in? We've heard from the state and national level, we'll call your provider first and do all this kind of thing. But the process actually kind of has a vortex that is right around both of you guys in public health and not only in this county, but surrounding counties that are listening or watching this show. They also have these public health organizations that are similar to exactly what you do. Their demographics may be a little bit different, but pretty much the same. So kind of give them a view of what's going on with that as well.
So with public health, we have essential functions. Those functions, we see various clinics in our public health system. Right now, we are looking at prioritizing those needs for the community. So we are looking at how we can adjust our clinics so that we have staff for boots on the ground work that are available to assist us with this effort. So that's kind of what we're doing.
Is there a movement, or have you done any in-home visits? Is that something that's has been done? Are you thinking about that? Is that the kind of thing that you have the staff to do with?
Yes, sir. So we have been out in the homes, like Ms. Wanda mentioned earlier. We're looking at contact investigations and things like that with the COVID-19. We have been in the homes of the community members. And
also, kind of just remember that what we're doing now is an extension of what we would do. An example would be if we have a TB case. If we've got a case of TB, we have to go out. We have to contact our whomever that person is, and then we look at who's living in the house with them. Then that circle gets larger. Who have they been in contact with in the community? And the circle may get even larger. And that's the same process that we're using with the coronavirus in contacting that person that may have the virus, looking at who's in his home, contacting them, and giving them specific information, then broaden that circle. Where else have they been? Where did they work at? Do we have a daycare that's involved? Do we have a school that's involved? And then you've got, not only that, churches. You know, people sometimes, some of our clients may be church members and they are very involved. So we have to take that into consideration also. So that's how we have also had to look at the coronavirus, because it is a contagious disease, and it is one of those that we in public health are required to go out and investigate and try to protect the public. Contain. We're in the containment phase, trying to keep people, if you're sick, stay home. That's what we're trying to do now.
And I think one of the things that folks have been hearing a lot about is some of that terminology that you just used. And one of those words is contain. The other word, Kelly, is mitigate. And what I want to do is kind of process that for a minute. And as people think about that really creates a whole different direction of flow of what we do or don't do. So when we come back from this break, I'd like for you guys to kind of help us understand what containment versus mitigation may be. Ladies and gentlemen, we'll be back in a moment. We're talking about local public health here and its impact as it relates to COVID-19.
Experiencing slow internet? If you have a fast internet package, the problem is most likely your wireless router. With more devices using Wi-Fi, your wireless router may not be able to deliver the speed and coverage you need. We now have the leading solution to enhance your internet experience. Using small devices in a mesh network, these Wi-Fi appliances cover just about any size home so that all your devices can operate to their fullest potential. Whole home Wi-Fi from Star Communications. Get the most out of your internet connection.
Welcome back. We Should Know is on there. I want to thank you again for being with us today. We're talking about a public health issue that is not only local, not only national, but it's global, and it's a pandemic, and it's called COVID-19 or coronavirus. We have two people that know something about this in a big way on a local level right here at your back door, the Director of Public Health here in Sampson County, Wanda Robinson, and the Director of Nursing, Kelly Parrish, that works very closely with you, Wanda, in making sure that the protocols and procedures that are rolled out on the national level and the state level and the regional level as they trickle down and finally get here are not only implemented, but they're understood by the people that you're implementing them for. And those are people we're talking to today. So I want to thank you again for being here. As we went off air, we talked about two words that we've heard a lot about. And one of those was containment, the other mitigation. On a big scale level, and either one or both of you can kind of help us understand this, we've recently heard that this idea of mitigation is now in play because we had an individual in Wilson County just recently, over the past few days, that was discovered that he got this virus and they can't seem to determine where it came from. Previously, we could trace mostly everything back to Wuhan, China, which is another word that's kind of new. So help us understand the difference in that. This mitigation thing, does that mean it's even worse or what?
So with mitigation, you're looking at wanting to lessen the severity in the community, the effects of the community. So typically mitigation does mean that they're moving to a different level of their processes. In the beginning, you automatically plan for containment and mitigation. You're looking at both. So they have that in their plans as far as how to mitigate the situation. But you're putting in measures in place to make sure that the severity does not get worse.
Well, you had I think that parallels with a comment you made about the TB test, testing for TB. People remember that. But once it goes from containment and then it goes to mitigation, that just means that it's out in the community, and the tracers that you were just explaining before we went to break, how to trace that, does that even complicate it more?
It does, because in most cases, any kind of communicable disease that we may have, we can usually find that that source case and can pick up from that source case and do our investigations or whatever. But now with the coronavirus being the one case in Wilson, they cannot associate it they can't associate it with travel. They can't associate it with any kind of contact. It's just kind of hanging out there. So that gives us pause, because then that, and I hate to say this, but that would bring forth the issue of, well, are there more cases out there, that we've not, and that's what concerns us in public health, is if you've got that case out there that is an outlier, that hasn't had any contact, then we have to go full-scale mitigation, looking at what else do we need to do to try to suppress the number of cases that we may have, because we've missed something somewhere. And that's where all these other guidelines, we've closed the schools, we've shut down the bars and the restaurants. We're trying to make sure that where anybody may gather, that we want to get that distance. We want people to stay apart, so that that we can just calm this situation down, stop that spread, and the only way you're going to do it is to keep people apart. So that is why all these new guidelines have come down from the state. We need to stop it. We need to see a decrease, not an increase. It's what we're seeing now. Each day or each week, we're seeing more and more cases. We need to stop that. That is we must stop that process. So,
Kelly, is this one of the times with a disease that if the public at large does not step up and participate, that we could really see this thing completely get out of control? Is the qualifier for folks listening to this show and watching this show today to say, look, this is on me. I've got to do certain things, and we'll talk about those in a few minutes, but those things I've got to do, and one of those that Wanda just mentioned is this idea of actually, if necessary, self-quarantining yourself. That's another thing we'll talk about. Is that so important for folks to understand, look, I've got as big a role in this as Wanda Robinson or Kelly Parrish or the medical director of whomever. I've got a big part of this, because if they don't act, we've lost it, right?
Right, yes, sir. So everybody plays a part in this. We want to flatten the curve that's going around some of the communication they're using, just to make sure that the public is aware of how important it is that even if you're not sick, just doing that social distancing. I think that's a term that everyone has learned very quickly. And that is the reason they do these things about shutting the schools down and shutting the restaurants down. Not to punish anybody, but just to make sure that we're not in a gathering where if there is community spread, that's not being done as easily.
Is it for you, Wanda, when you look at it, and I know you've been in hundreds of meetings over the past few weeks, more than probably you can imagine, but here, when you look at this from your position and you think about all these things that are going on, what does folks need to know about their children, about when school may or may not start back, or even if it does? I noticed Kansas has extended its schools throughout this year to basically postpone the school for the rest of the year. These are things that's creating a sense of anxiety and angst for folks out there.
So we urge calm. We want folks to step back and not panic in that. We've got those guidelines out there, and we hope folks will abide by those guidelines, and that stay at home, stay at home. Good hand washing, which we are stressing day after day, good hand washing, social distancing in that, don't bring all the neighbors' children to your house while you're home, separate, don't do that. But that's our, and good hand washing is things that we should be doing anyway.
Yeah, absolutely.
Hand washing and, covering your cough with your elbow or whatever, but, and wiping surfaces, keeping those clean or whatever. Wearing a mask. If you are coughing, if you are sneezing, separate yourself, move out, put something on. So that's what we are really recommending now.
One of the things you just mentioned, this idea of covering and so forth on the national and state media, PPE, personal protective equipment, has been a big issue, Kelly, and I know with Director of Nursing, you know how important that is. How do we stand on that? Is this county and other public health agencies in rural areas, and I keep saying rural areas because we do represent majority of our listening audiences in rural areas, how does it compare? Are we getting access as well as some of the more, should I say, affluent areas?
We are, yes, sir. We have procedures in place that if we do have a shortage, that we have a resource we can call and request more resources. We do have that.
The idea of assistance, what can the communities do? And Wanda, I think you mentioned a point that every time I'm doing something that I see it needs community involvement, my first thought goes to steeples and churches, and we got a bunch of those in the county. Is there a way that those steeples and churches can truly use what drives them, this sense of faith, to now channel that and help in the way that can be positive for outcome here for you guys and everybody else, really?
Almost certainly. As we all know that our ministers, our different folks here in the county, a lot of times, that is where most people get their information, is from their different ministers or whatever. And we hope that they would take a lead in that, not only abiding by the guidelines of 100 or 50 or less, but actually educating their folks why they got them there. And then we have a lot of churches that have decided to just not have services and those kinds of things, and do a lot of things by either Skype or using the telecommunications, that kind of thing. And we are glad that they're doing that. But to help us get the word out in the community, that is one of the main places that we've used in difficult times, and hopefully we'll continue to do during this epidemic. So
it's that wild card, Kelly, that oftentimes strikes me as a real concern here, because if you have one person that ends up being like the guy in Wilson that don't know how he got it, and all of a sudden he's got it, we don't really know how many of those people are actually out there walking around. Right, correct. So how do we suspect, or what have you guys looked at to say here's things that we need to do, and how can the communities and the folks out there listening help you with that?
So the social distancing piece is the main drive home point. Just making sure that we are practicing the social distancing, following the guidelines set forth, making sure we're not in gatherings, and even, funerals, the community members maybe feeding a family, and there's going to be 50 people, 50 family members in the fellowship hall, and they're providing a meal to them. Not doing things like that at this point, just to limit exposure to if somebody is walking around that we don't know has the virus.
And that is discovered at some point in time, either that person gets worse or iller, or they maybe go through it, and we may never know. We may never have that information. Is that correct?
Right. But they may never exhibit symptoms.
Right. But still, our point is, even though it's like anything else, you treat, at this point, you would treat any contacts, like you and I today, we're hopefully six feet apart, but treating any contact as a potential exposure. And that would include hand washing, standing back, if there's a cough or whatever, wearing a mask, Those are just some of the things that we recommend.
We're going to take a quick break and we'll be right back. Ladies and gentlemen, stay with us. Call a friend. We're talking about COVID-19, Corona.
You come out to replace a bad sensor, and that adds a 5-year commitment to my contract, and you don't tell me? Here's your sign.
Switch to the sign that's keeping homes secure and customers happy all over the area. Security from Star Communications. We pride ourselves on fair pricing and quick, friendly service every time.
Somebody trying to break into this place?
Security from Star Communications.
Ladies and gentlemen, welcome back. We Should Know is on there. I want to remind you to reach us. You can email us at weshouldknowedu@gmail.com. That's weshouldknowedu@gmail.com. You can send us a snail mail, postcard to Post Office Box 1482, Clinton, North Carolina. Would love to hear your comments about shows we've had, suggestions about shows you would like to see us bring in. What we try to do is bring you to people that are in the know, oftentimes in the vortex of what's going on, to give you factual, direct information, and that's what we're doing today with Wanda Robinson, Public Health Director, and also we have Kelly Parrish with her. She's the Director of Nursing, which tells me if Wanda can't get to it, it's automatically on your plate, right, Kelly?
Yes, sir.
So we've talked a bit about the protocols and applications on a local level with COVID-19 or coronavirus. The COVID-19 is more the specific part of that. When we look at that, we've heard a number of folks say they're self-quarantining, or they're self-isolating, I think, sort. And then you hear folks say, well, this person that I know is, they have asked them to be in quarantine situation. What is the dynamics of that? I mean, should we not look at it as two different things, or is it the same thing? Either one of them.
So self-isolation is when we've got a situation where there may be a sick person that we want to isolate from the public. So that means that we want you to stay put, stay out, don't go to the stores, don't go to the doctor, just stay in place until the symptoms have left. Quarantine on the other on the other side of the pole is we are trying to isolate well people. We don't want them to get sick. So when we look at quarantine, it's usually a larger sector in one community that we stay in place. Don't want you to get sick. Mm-hmm. But when we're isolating that person that's probably had symptoms or the contact or sick, that we're saying, and that's the way the two definition is: isolation, you're sick, we want to make you stay put. Quarantine is you're well, and we want you to stay well. So right now, most of our folks are going to be isolation or home on self-monitoring, and that way we can keep that spread. So that's the definition of those two.
Kelly, one of the kind of uniquenesses, I think, of a rural area, of a farming area in the state, and this speaks to a larger portion of North Carolina that is agricultural or ag-related. There's a lot of things that the folks do that is in a farming job that's a multi-million-dollar industry just on an individual basis. They have to be there. I mean, this is not something you can say, well, you can go home and do something from home with your computer and that kind of thing. There's got to be trucks rolling. There's got to be things moving. Does that make it harder based on the isolation thing for spread because of this constant moving? I mean, and plus it's something you can't shut it down because it's the food chain.
Correct. I think self-isolation and quarantine looks different for everyone depending on your home situation. So just say we have a case and we have a family, we tell the case and the case to use another bathroom, use a separate part of the home if necessary, kind of stay in one central area in that home, and using that different bathroom if at all possible, to try to even separate the sick from the well family members in the home as well. So it looks different based on what your situation would be, but we could help with anyone that had questions with that. If they just reach out to us, we can help answer any specific questions.
Give us some predictions, Wanda, on what you'd like to see. Do you have we've got the schools now, of course, are shut down technically. Children are at home. Should communities and these representative communities of churches and others be messaging to folks to do community kind of stay in your community or stay in your home, or where should they be? I guess my point would be that oftentimes folks will say, look, I live in the country. Is it okay for me to get out and, I don't know, hike, walk, ride bikes or whatever? Right. Is that even a question? I think the extremism is what really rattles folks.
We do want people to stay at home. I think that's the one piece. Stay at home. Not a lot of just stay at home, stay in place. Of course, we do want people to go outside, because that is one of the things that can actually help us with containment of the virus, is being out in the sunshine and exercising and staying healthy and those kinds of things. The only thing is we just don't want the gathering where you have groups of people together. But our message today is stay at home. Use the recommendations. Wash your hands. Cover the cough. If you are sick, and call your doctor first before you attempt to go to a provider, because they're going to give you directions as to what to do. So that is our main message today. Stay at home, use good, such as washing your hands, cover the cough, and if you feel sick, call your doctor first. Don't go. Call the doctor, and then they will give you the information that you need in order to seek care. So that is our main message today.
Kelly, we're in the pollen season. We're in the hatchew season. We're in the your throat gets raspy, those kinds of things. Does that kind of add to the paranoia as well? Because all of a sudden you start coughing, and somebody, even in just the limited traveling, a lot of folks say, well, I started coughing, there was 3 people staring at me and that kind of thing. There's a sense almost of shaming as well, you're like, what just happened? I didn't mean to cough. But a cough now versus a year ago or even 4 weeks ago is a different thing, is it not?
Right, it has a stigma now.
It does.
It really does. So somebody said it's a mighty awkward time right now to have seasonal allergies.
Yeah.
So yes, sir, it really does. But trying to distinguish just the seasonal cough, and it may be easier in some cases than it is others. Talking to your providers about, is this what you normally do during your seasonal allergies? Do you have that added component? So what we're looking at right now is, do you have the fever with the cough, shortness of breath, any trouble breathing, things like that?
How is telemedicine working for us in rural areas as easily as it is for folks in urban populations in this state?
Believe it or not, it really is. And we have providers here in town that's using telemedicine as we speak. And that's why we say, if you're having issues, call your provider, because it is being used more so now than it ever has been before. And that is here in our local community that we are using telemedicine. So yes, we do have access to that, just as a larger county would.
Are the providers in the county readily connecting with you guys to make sure all information is being fed to kind of a central source for analytics and those kinds of things? Is that happening very easily, or do you still feel kind of maybe left out in some areas? Would you like to see that improved? What would you say to all those providers out there?
So we have had a good relationship with our providers. We've been working with the local physicians' offices, the hospital, our Commonwealth Health, the Goshen centers, but we have had a good relationship in sharing information back and forth. If they think it's a case, they're calling us. We're trying to manage those kinds of things, making sure that we're all in the same place. We have a very active system where we're emailing back and forth, any recommendations being brought in and then put out into the community. but we have had an excellent relationship with our providers in the community. And I think that's one of the reasons for our successes is that we have had that relationship of sharing and Kelly, would you like to expand? But an excellent relationship. So,
and I think situations like this, although you don't want situations like this, but situations like this does make the community stronger. It makes our partnership stronger. Sometimes public health, we are kind of put on, we're kind of in the background doing our work. So in situations like this, we're actually brought to the forefront, and we're actually making those connections even stronger. And it helps our community. It makes us stronger. Just like the same, and we're trying to kind of correlate this as the same sense as we're in a disaster response, just like we would be in a hurricane situation at this point. And just the community just comes together after a hurricane, after an event like that. And we're doing the same thing with this.
The connection with the providers throughout the county, you mentioned Commonwealth Health and others at the northern end of the county. We're talking literally hundreds and hundreds of people that those folks see that typically folks may think, well, you either go to the medical clinic or you got 2 or 3 private doctors in the area. But a large portion of the folks that you've been seeing for years and been working with for years never show up at any of the major kind of connections as far as health. Is that correct?
That is correct. And so we are doing some testing at the health department. And so we are there for those that may not be able to access systems as the providers or whatever. I've not had any issues yet where I've had someone to say, well, I have no access is there. When they call us, the health department, if they can't provide that service, then we're going to pick up, because we're like a safety net. The health department has always been a safety net to catch those that cannot otherwise receive care anyplace else. And we're serving in that same capacity now during this pandemic. But we've had a good relationship with all of them. I think all of our different agencies that we've had contact with over the last couple of weeks.
I want to take a break, but when we come back, I'd like to expand on that conversation a bit and maybe highlight some things that over time the health department's been doing. Folks hadn't recognized it, but now, as Kelly just pointed out, you guys are the head of the spear going forward. Ladies and gentlemen, we'll be back in a moment. We're talking with the folks that are in charge of public health here in Sampson County, who is at the vortex of this battle with the COVID-19 virus that's affecting all of us. Stay tuned, call a friend, we'll be back in a moment.
To get the most out of your electronic devices, you need a strong internet connection and a protected home Wi-Fi network. You need high-speed internet from Star. Star has the fastest, most affordable high-speed internet service available for all your devices. We have no long-term contracts or high-pressure sales. Our service speaks for itself, and switching is hassle-free. We take care of everything with free installation from a local company. High-speed internet from Star. Internet at the speed of life.
Ladies and gentlemen, welcome back. We're coming up on our last segment here at the show called We Should Know, information and education that not only you need to know, but that will help you move through the day, help you move through the week, and hopefully a very successful year coming forward. We are dealing with a virus that has disenfranchised, relocated, complicated, conflicted, and moved society in directions that we never thought we would be doing. We're not really sure where that needle is going to take us next, but 2 people that are in the wheelhouse of this thing is Wanda Robinson, who is Director of Public Health, and of course Kelly Parrish, who is the Director of Nursing that works with Nursing Health. On break we were talking about this, Wanda, this idea that public health has always been there. These public health agencies, we call them the health department, has been there as long as I can remember. I even remember, I'm showing age now, but I can remember when it was located adjacent to the hospital. It was called the health department. Kelly's going, God, did really do that? So I can remember, but it's always been there. But now we're at a time in history when you guys are at the very core of something that has the potential, if we don't do the right thing, of destroying everything that we've built and what we know. And I don't want to do that to continue to create anxiety, but the plan is in place if folks will listen. Kelly, you alluded to that a while ago. Folks, just remember to, do what we're asking you to do. How much more help? Has people stepped up? Is there folks that can volunteer to help? Is there things that you need that we're not aware of? Either one of you.
So we have had folks step up, and if you wish to volunteer, you can call us, and if we get to a point where we need those volunteers, we'll have that list of folks or whatever. But our providers have stepped up. They've really helped us with the testing and with any other things that we may need. I'm just trying to think through some things, and just remember, once again, public health has always been there. We've always been there. We're not going anywhere. This is what we do. This is what we do. So we just want to make sure folks understand that. So,
Kelly, address that question. What do you need? You've been through all these meetings, and from your eyes as director of nursing, and that title, I'm sure the description of that has changed radically over the past 3 weeks. So when you look at that, what are the kinds of things that strike you? And when I look at you also, you're kind of in that millennial community that we really need to message folks that, because I remember at that point in life, I was in my brain, I was invulnerable. It's like ain't nothing gonna hurt me. And we still have that happening out there. Give us a sense of what you're seeing from where you're sitting.
So the messaging that I'm seeing that I agree with is that, it's really not about maybe the younger generation maybe acquiring the virus and then getting severely ill, because we're not seeing that generation become severely ill at this point. But those people can give it to their grandparents and the people that we are concerned about becoming severely ill. So it is about them staying home as well and containing themselves, so that we make sure that we're not spreading it to someone that may be in that vulnerable population.
So Wanda, point I want to try to make sure I cover today. I've got a list of things I want to make sure I must cover. One of those is, do we have access to testing readily available, that if you have somebody that's identified by a provider or that comes into your office, do you have the necessary stuff to test those people, to process that, and how long does that process take? First, do you have enough? Second, how long does the process take? Actually, 2 questions. I'm piling them on you.
Right. And if I miss something, I want Kelly just jump in. So right now, yes, we do have testing kits. We working with our providers. If someone needs a test, we can provide that test. But remember, there is certain criteria that must be met for us to test.
It's not a community screening.
It's not a community screening, and we will only test after being in consult with our state and our providers. Those criteria are: you must have a fever, cough, fever, coughing, shortness of breath, difficulty breathing, and at one time we were saying travel out of the country or travel back into the country or a contact to a case. Those are that is the criterion that we go through. And if you meet that criterion, we will provide that testing, but you must meet those criteria. We are not doing testing for someone that says, well, I think I may need it, or we're not testing asymptomatic people at this point, because we've got to keep our testing for those that really, really need it. And that's the criterion that all the providers are using. So if we are in that loop, that if people need a test, they're calling us, we're walking through the criterion, and we will test if need be. We feel comfortable in saying that we have enough tests to do what we need to do for those that meet that criterion. So, and we do ask people to call us, and they can call and inquire. We have our numbers posted, and we will direct them in the way they need to go.
So, and Kelly, that sounds good. Does that change the picture any since this person in Wilson has been moved to a mitigation point that nobody knows any contact the person's had? Does that change the idea of having direct contact or coming from another country or traveling or anything?
was still the same that Ms. Wanda described at this point.
Okay.
Once testing becomes more readily available in mass quantities, we may look at the community testing.
Does the person have to go to a provider and then it goes through public health? Can they come directly to your office and say, or call your office rather, preferably call you and say, hey, I've got this, this, and this, and then you tell them where to go or what to do?
Right. We're not going to bypass our providers, but if we have somebody out there that need and don't have a provider, then we have a system in place to handle that kind of issue. But they can call us, and like I said, we will direct them as to where they need to go to obtain that testing.
I was talking with some folks at Clinton Medical Clinic. It seems they have a kind of a very well thought out process in place out there. I mean, you don't just walk in the door anymore. You're stopped at the door, keeping again that social distance, and you explain what your situation is. Then you go back to your car and they call you to go to wherever you need to go. They're not just putting everybody in a room. So something has been well thought out. Is that something that came as a result of the communication with public health and other agencies to happen?
Right, and we're going to put some of those same things in place next week, and that as of Monday, we will not allow anyone under the age of 17 in our building. We're going to start screening at the door and trying to do some getting folks where they need to be and triage. Thank you, Kelly. Triaging folks. If you're sick or whatever, you're going back to your car. We'll go out to the car, which we've been going out now testing. We've been doing curbside service for some testing. So we're going to put some of those places in our building also. We want people to call before they come because we don't want sick people in our building. We want people to, if they come to the health department as of Monday, they will not be allowed to just walk. We're going to do a screening. We're not going to allow children in. We don't want people to come with the extra family member or whatever, because they're not going to be able to come in. If we're going to see somebody, it will be that client only. We're trying to cut down, even in our building, all those folks in our building. So that is something that will be happening.
Because that's an exposure problem.
That is an exposure problem.
People sometimes get it confused and think, well, they just don't want to see me, or I don't have whatever kind of right insurance here or there, but it's more exposure, right?
And we've got to look out for our staff too, because we realize now at this point, especially with the community spread, that is why now it's like, okay, public health in Sampson County, you need to make sure that we are protecting our staff and the public. So, because we realize we don't know how long we're going to be in this pandemic. So, those processes will be put in place next week.
We've heard a lot of conversation on the national level, on the state level, about respirators that patients may need once they have been identified having this problem, and maybe they're at that age that they literally can't fight it off themselves. How are we in rural areas, particularly in this area and surrounding counties, as it relates to the numbers of respirators that patients may need? I've heard anywhere from 10,000 to less than 2,000. So is that something that local rural hospitals or that the health department has access to for those kind of disenfranchised folks that typically don't have insurance or anything?
Right. So that's a hospital question. I know that our local hospital has a plan in place and looking at those kinds of issues, but that will be a question for them. That's been handled by more so them, and we have emergency management now has opened up, and we are at maybe a limited activation because we realize now that we've reached beyond public health and we need that other parameter around us. But the hospital, that is something they are actively planning and kind of getting things in place. So.
And the measures we put in place as far as the guidelines set forth to the community will hopefully prevent an influx of everyone at one time coming into the hospital setting, taking up that equipment. That's another piece. That's why we're trying to be proactive.
Flattening that curve.
Flattening that curve.
So that everybody's not sick all at one time.
Well, we're looking at a number of things we can do to try to help get information to the public, and we may be doing some kind of unique approaches with Channel 16 and Star Communications to try to help that. This is going to be, as you just mentioned, an ongoing issue There's no way that anybody really now has a crystal ball to say when or a week or not.
No, and you know, as we look at that curve, that's going to determine what measures we use from now. If we can get that curve down, if we can look at the number of cases that are being reported, that's where we are now.
All right. I want to thank you for being with us today. We come up to a quick close here, and best of luck in the future. Ladies and gentlemen, I want to thank you for being with us today. We look forward to seeing you again next week. And as always, may God.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.